Can children use dry powder inhalers safely? Have you ever wondered if children can safely use dry powder inhalers? The good news is that most primary school-age children, typically between the ages of 5 and 11, can use these inhalers safely and effectively. However, there are some important things to keep in mind. First, children need proper training and support to master the correct technique. Dry powder inhalers, often called DPH, work by releasing medication when the user inhales quickly and deeply. This means that children must be able to generate enough airflow to use them properly. When considering whether a child can use a DPI, age and ability are key factors. Generally, children aged 5 and older can handle these inhalers well. However, younger children or those with coordination or breathing difficulties may find it challenging. A healthcare professional can assess whether a DPI is suitable for a specific child. Using a DPI correctly involves a few steps. First, the child should breathe out fully, away from the device. Then, they need to seal their lips tightly around the mouthpiece and inhale rapidly and deeply to draw the powdered medication into their lungs. It is also important for them to hold their breath for about 5 to 10 seconds afterward. This helps the medication settle in their airways. Training and support are crucial. Children need adequate instruction and practice to ensure they use their DPH correctly. Regular check-ins with healthcare professionals can help maintain proper technique and ensure that children are sticking to their medication plans. When comparing DPH with other inhalers, one advantage is that they do not require the hand-breath coordination needed for metered dose inhalers. However, during acute asthma attacks, some children may struggle to generate the fast, deep breath needed for a DPI. In those situations, metered dose inhalers with spacers or nebulizers may be better options. Safety and effectiveness are important to consider. When used correctly, DPH can effectively deliver medication to children's lungs. They also have a lower environmental impact and are more portable than metered dose inhalers with spacers. However, there is limited evidence about using DPH during acute asthma exacerbations, so careful clinical judgment is essential. Here are some practical tips for using DPH. Children should avoid breathing out into the device, keep it level to prevent losing medication, and rinse their mouths after use if the medication contains corticosteroids. This helps reduce potential side effects. In summary, dry powder inhalers can be a safe and effective option for children with respiratory conditions like asthma, especially for those aged 5 and older who can perform the required inhalation technique. Proper training, assessment by healthcare providers, and ongoing monitoring are vital to ensure safe and effective use. For younger children or those unable to use DPH correctly, alternative inhaler devices or nebulizers may be recommended. Always consult a healthcare professional for personalized advice.